One of the best parts about seeing your primary care provider is that sometimes they see issues that you might not even realize you have. And we all know tackling something early is always the way to go. Here with Insight is Dr. Asher Strauss, the Director of Behavioral Health from Kinwell Health. Welcome to New Day.
Thank you so much.
Yes, and so this is such an important conversation, and primary care providers have been starting to change some of the forms too that you fill out when you visit. Can you tell us about that and why the change there?
Yeah, I think we have started trying to be more direct in asking for really important information about your emotional well-being. Signs of depression, anxiety, loneliness, which has been particularly impactful since the pandemic.
Definitely. And is that why this was important with the change, to be a little more direct with the verbiage? Is that what you're feeling was missing there?
Well, I think it's always been something on the medical provider's mind, but being able to help the patient bring that forward and be able to really hear the way that somebody's mental well-being might be impacting their physical health.
Yeah. And what's an example of someone being impacted by their mental health that they may not even realize?
Yeah, I think actually a lot of the things that we see in primary care can have an underpinning of emotional distress. So sometimes people come in with headaches or GI distress, they're having trouble sleeping, or they're having a lot of arguments at home, and it leads to the physical distress that prompts people to come into the primary care clinic. And although there could be physiological reasons that those things are happening, there's also a lot of emotional reasons that can trigger those same symptoms.
Yeah, and to be able to, I guess, pinpoint and look at both, not just physical, but mental health is so important. And Kinwell Health has something that's called integrated primary care. What does that exactly mean?
Yeah, many primary care organizations, particularly in the Seattle area, but growing across the state of Washington, are starting to do integrated primary care, which means bringing in behavioral health clinicians, people who are trained as mental health professionals, to think through the variety of ways that we can help benefit a patient alongside the medical provider.
Wow, incredible. And it can be hard, to reach out and ask for help. So what do you think people should do if they feel like they need help?
Filling out the forms as honestly as possible is a great place to start. And even if there isn't a form, trying to be brave and just bringing forward what you need to talk about, whatever the concerns are. If you've been feeling more on edge, if you've been feeling more stressed, those are really helpful things to bring forward to your doctor. And at places like Kinwell, where we're providing advanced primary care, we have the opportunity for our medical providers and our behavioral health clinicians to work side by side and bring both of our minds together to make sure that we're covering all of our bases and taking care of the whole person.
Yeah, and why Kinwell Health then?
Kinwell Health is an exciting new organization that is bringing advanced primary care. So we are valuing quality-based care and relationships with patients, as well as offering an integrated care experience where we bring different disciplines and professions together to help take care of the whole person. And so medical providers have more time with their patients to build those relationships, and everybody at Kinwell has a behavioral health clinician as part of their care team, but not everybody's met us yet.
Wow, that's so amazing. Thank you so much for being here and sharing this information, such an important topic.
Thank you so much for having me.
Yes, and to learn more about what we discussed today or to get in touch with Kinwell Health, please visit the website that you see right there on your screen.
This portion of New Day Northwest is sponsored by Primera Blue Cross.